Hi, my name is Anna, and I am going to have an audit. I'm going to talk to healthcare professionals who are in the emergency room, who deal with patients on a daily basis. Um, to me, I would define sex as either being male or female, either having the XY for male or the double X for females, having their reproductive system, whether they have testicles or they have ovaries. That's how I would define sex. The gender would be masculinity or femininity. So today I'm going to share a story with you that blew me as a healthcare professional. I was working in the emergency room at the time. I was working as a paramedic actually. I had a young female come in. She was 42 years old, petite. She had stated, she had some symptoms of weakness. She had some dizziness, and she now started having some little discomfort, like some indigestion. And we did a cardiac workup. All of her labs and her testing had been normal. And then she had mentioned to me that she had seen a cardiologist in her hometown, and they did different procedures because she had been passing out at the time. And she just kept having, every time she took a deep breath, she experienced more of the chest discomfort. She had no pre-existing history, no diabetes you would look at, no kids. She stayed pretty active. She didn't do any recreational drugs. She was just not your classic chest pain. You try to kind of make a field diagnosis of what's going on. So brought her in, did her lab work, got an EKG. All of that was normal. So we're gonna wait for the ER doctor to make his rounds, and of course, if being in the ER, you gotta, there's a way you triage patients and address certain issues that they're having. So we went ahead and put her in. Sorry, we went ahead and put her in observation, and I'm a chef. I started working, and here I hear code blue in this observation room. And I was dealing with patients. It was a very hectic night, as most ERs are. Come to find out, my little young lady, who's 42 years old, had stopped breathing. Her heart stopped. So of course that hit me pretty hard. I'm like, you start going over your head. What did I miss? I did my assessment. I looked at what, I paid very attention. I paid particular attention to what patients tell me, even more so to what they don't. And it just didn't, I couldn't figure it out. So I did follow up with her. And, after she came out of ICU, and I was, trying to get some information from her cardiologist. I said, she has had these issues in the past. They've done certain exams. I think they've even done what they call an angiogram. An angiogram is a test that looks at the coronary, and I'm going to show you a picture of the heart so you can have an understanding. The coronaries are the arteries that feed the heart. So a doctor can go in and look at the main arteries and some of those smaller ones to see if there's any blockages. So she's had that. She's had lab work that everything was negative, and so I wanted to know, did she have something that she was born with, that maybe the pump function or something or other that can give me an idea of what was going on, because I felt like, of course I felt, I felt like this is my fault. Did I miss something? So as I was talking to her cardiologist, and she was a female cardiologist, and she started talking to me about her symptoms. for females, and I didn't think about this, I being in the healthcare profession, you look at having chest pain, the shortness of breath, are you having signs of a heart attack? So she pointed out to me the difference between male and female. Yes, hearts look the same, but in females they're smaller. The pumping of the heart for females is 10% less than that of a male. I had no idea. I had no idea, and as I started talking to her, I got more intrigued. And I said, well, she's 42 years old. She doesn't fit the actual protocol, and given the fact that all her tests were negative. So of course, here I want to know. I'm just like, I'm scared, because I do have a family history. I was pretty much, I was like 45 at the time that this incident happened. So we're close in age, and I have that family history. I have all of the above. And so as I started talking with this female cardiologist, she gave me some insight. She said women's, of course, the heart for females are smaller. The pumping function is also smaller. The arteries are smaller. So when she had this test called the coronary angiogram a couple of months back, before she even had these other symptoms, it was negative. And so she explained to me, as she went in a little differently, because she knows the female heart and the structure of the heart, as she specializes in coronary artery disease for women. She went ahead and showed me these imaging, and sure enough, this 42-year-old had a blockage. She had 96% blockage. That was missed. It was missed because the testing that is normally done by cardiologists tend to not look at females' anatomy or coronary arteries different. They kind of do the testing the same way that they would do a male. How she had that blockage is, she explained that some of her arteries are smaller, and that could have just been, something that her arteries are just small. Some people are made like that. So she gave me some information that I use now, being now that I work in a clinic in cardiology, and how we treat females. We pay that much more attention to what they do tell us. The actual symptoms of that of a male and that of a female are different. And so we treat each person with a unique sense. We take for granted that everything that happens to a male is going to be that of a female, but we're totally different. So gender health, we do this now in our clinic. Everybody that comes in that is over the age of 18 is treated, and regardless of age and don't fit the profile, we do a little more aggressive treatment. So I also want to share with you, we do what we call a cardiovascular, it's a cardiovascular test profile. This gives us some information as far as male versus female hormones, what you're predisposed to as far as metabolizing, how you distribute, your excrete your medication, and what works for you. I learned from that I don't take anything out of, whether they fit the profile, they don't fit the profile. We treat each patient as they're unique. There's a reason why they're feeling here. There's a reason why they're coming, and you need to pay attention. And there is a difference between male and female. Know your numbers. Know what works for male versus female. There is a difference on where you want those numbers to be. I strongly urge that if you're female, see a cardiologist who's a female that specializes in coronary artery disease for you or your family member, because it does make a difference on how your anatomy and how the treatment and aggressive the areas that they need to be. It can make a difference between life and death. I hope you like the video, and I hope you like the mustache. Thank you.